Welcome to Savita Dental College Lecturecast in Dental Implantology. Today our topic is bone augmentation. What do you mean by the word augmentation? In simple, augmentation means build up or act of increasing or raising a deficient part. In dental terminology, bone augmentation is a term used to build bone so that dental implants can be placed. For bone augmentation, we need bone graft material which is used to recreate a new bone. So different bone graft materials are available like autograft, allograft, alloplast and xenograft. Autograft is a bone which is harvested from the patient's own body. It can be harvested extraorally or intraorally. Extraorally, we can harvest bone from iliac crest, fibula, scapula and tibial. Whereas intraorally, we can harvest it from ramus, mandibular symphysis and body of the mandible. And extraorally, iliac crest is the most widely accepted the donor site for the large defects of the maxilla and mandible. And the most common site is the anterior iliac crest, which is pointed in the diagram. It provides generous amount of cancellous bone. And just opposite to that is the scapular bone, which provides very limited volume of the bone and especially from the lateral border of the scapula. And fibula, where a length of about 25 cm can be harvested, and this straight fibular bone can be made into multiple osteotomes which has to fit the contour of the maxilla and mandible. Tibia, which is also called as shin bone, is indicated when blood supply is severely compromised to the graft site, but this area is contraindicated in children and adolescents. Intraorally, the bone is harvested from mandibular symphysis, ramus and retromolar pad and the chin area and the body of the mandible. Allograft. It is derived from the genetically unrelated member of the same species such as a cadaver bone. The examples are demineralized freeze-dried bone and freeze-dried bone. Xenograft involves the use of the bone that has been taken from the other species such as cow. For example, it is bovine origin. And this bone is harvested from healthy cow and it's processed to get an end product containing only the mineral content of the natural bone. And in market, it is available as bio-os. Allograft, it is an inorganic material used for the bone substitute. The material used are hydroxyapatite, tricalcium phosphate, glass ceramic or bioglass. Now we shall move on to bone augmentation procedures. The first is the sinus graft, the second is the bone graft and third is the ridge preservation. Now the sinus graft, which thickens the wall of the bone that forms the upper jaw, and the bone graft, which replaces the height and width of the bone where the bone is receding. And the third is the ridge preservation, which fills the empty socket that has been extracted. For all of these procedures, we do require the bone graft. Let's move on to steps in bone augmentation procedures. The first is the preparation of the recipient site, the next is placing the graft material, and the third is approximating it with sutures. In the preparation of the incipient site, incision plays a vital role. Three types of incision, that is the mid-cristal, relieving circular incision and the papilla preservation incision. The cristal design is made along the crest of the ridge. This incision is preferred because it results in less bleeding, easier flap management and faster healing. And the next step is placing the graft material. We do have different sizes of the graft material as block grafting, particulate grafting and graft and membrane stabilization. In block grafting, just have a look at the video. The procedure involves removing a small block of bone which is approximately a centimeter from either side and transferring that bone to the area of bone deficient. These are used in area where there is large bone defects as in case of trauma, infection, cyst or tumor. Just look at the video how they have taken a piece of a graft and replacing it in the deficient area. And these can be stabilized with the membrane stabilization. The next is the particulate grafting. In particulate type of bone grafting, bone is crushed into small particle and mixed with blood and placed in the defect, and it can be stabilized with the membrane stabilization. the bone graft with the membrane stabilization. In this procedure, we can use a block graft or a particulate graft which is stabilized with the membrane stabilization. And now let's come on to approximating it with suture. There are different suture techniques. The first one is the interrupter suturing technique, the second is the horizontal matrix suturing technique, and the third is the continuous suturing technique. This video demonstrates the interrupted suturing technique. The needle enters 2 to 3 mm away from the margins of the flap, as you can have a look at this video. And the two ends of the sutures are then tied in a knot and are cut above the knot. Make sure that you don't pull or stretch the tissues and hold the tissue gently with the tissue forceps. And this video demonstrates the interrupted suturing technique. Just look at that. The needle should be grasped with the needle holder approximately 1/3 the distance from the eye, and the needle should be placed perpendicular to the surface being entered and pushed through the tissues following the curvature of the needle. Make sure you do not force through the tissue. This may bend or break the needle. And in the same way, exit at the distance on the opposite side. To avoid tearing the flap, the needle must pass through the wound margins one at a time. And over tightening of the suture must also be avoided, as well as overlapping of the wound edges when positioning the knot. And this holds good for all the suturing technique. The next is the horizontal matrix suturing technique, and this is continuous suturing technique, and this ends the steps for the bone augmentation procedures. But do not forget, instructions to the patient is most important, and recall of the patient. And this concludes the class. Thank you.